Mark, thank you so much for taking time out of a very busy world that we're all working in and living in to come on and talk about TMH and really what you all are doing in your role to be a healthcare provider, not just in the capital city, but as a region. So, Mark, thank you if you can with you.
Okay, let me introduce, I'm Mark O'Brien, I'm the CEO at Tallahassee Memorial HealthCare. To my left, to your right, is Dr. Dean Watson. He's our Chief Integration Officer, a long-term physician servant in our community. To my right is Ryan Smith. He's our Chief Clinical Officer. He oversees all the clinical services, including nursing and other allied health services that support the needs of our organization.
Okay, wonderful. Thank you, gentlemen. Thanks for taking time out of what we know is a very, very busy schedule to be with us. We know the business community, but really our community as a whole is tuned in to this COVID-19 and its impact globally. Most importantly, we want to try and talk about locally what's going on. And so, Mark, if you could start out by maybe just giving us the overall sense of what TMH is doing to combat this virus within our community as we sit here today.
I will start off, but certainly these two need to weigh in because they're really some of the chief architects and builders of the programs that we put into place here. TMH is a community asset, is a regional quaternary safety net facility. We recognize that our responsibility isn't just to take care of patients within these walls, but really to look at and focus on the needs of the community as a whole. COVID-19 is one of those things that's going to impact all of us, and we realize that. Now, it impacts us to different degrees, but there are populations, certain populations, segments of the populations that are certainly at a much higher risk than others, and you can't protect them without protecting the whole. So as we've looked at TMH, there's both an internal and an external focus. The internal side has really been around how do we prepare for the influx of patients. How do we manage those patients while at the same time protecting our staff? Because the people who care for these patients are the nurses, the respiratory therapists, the patient assistants, the patient care assistants, all of those folks engaged in the direct engagement of making people well. If they get all sick, if they all get sick, they can't take care of the patients coming in. So we've got to protect them. And then we also, of course, provide support for all the other health needs of the community. So the internal focus has been around how do we create environments that protect the patient, allow us to provide treatment, also protect our staff, and provide the best outcomes possible. And I'll let them talk about the negative pressure rooms, the PPE situation, all of those things. And quite frankly, we recognize that we've got to take a very active front-end approach to that. The second thing is, the best thing to do is to stop the spread or reduce the rate of spread of COVID-19, which is one of the reasons why you'll see us look for new vehicles of identifying and diagnosing patients. Very non-traditional tools such as telemedicine, which is really, I think we've recognized here as a leader in telemedicine at TMH for quite some time, is finally being recognized by the world and certainly our community as a very useful and appropriate tool for situations like this. So what we're trying to do is create a safer environment by building on the social distancing, the physical distancing, and creating remote testing sites, pulling patients out of the doctor's offices, pulling patients out of urgent cares, certainly pulling them out of ERs, pulling them away from populations where they can infect others. And so that is one of the reasons why I think Ryan, Dr. Watson, and others were involved, working very closely with the city, who, by the way, have been phenomenal in developing the Northwood Center drive-thru collection center. We actually tested that model here first last Friday, and then again on Tuesday we set it up, but we opened it for the community on Wednesday. So we both have an internal external plan. I'll let them talk to some of that if you want, but I think some of that ties into some of the other questions, but I don't know if you want to talk about internal first of all.
Absolutely. So as Mark mentioned, we have two primary focuses. The one, how do you take care of patients that don't need the inpatient care? And that's really the testing centers that we talked about from the Northwood Center, as well as our internal processes. When you look at global statistics, about 80 or 90% of the patients that had the COVID-19 don't require the inpatient care. So it's the education, it's making sure that our staff are protected, making sure that we educate the community appropriately to say that you're an appropriate candidate for these testing type centers. Make sure they have a good relationship with their primary care physician to do the screenings and follow all the processes around the DOH and CDC requirements, and then refer them to the appropriate area. On the inpatient side, if they need that care, we're here, and that's been our goal. And we've been doing a lot of efforts working with our leaders internally. We have an outstanding team here to educate the nurses, to educate the staff, working collaboratively with medical staff, making sure that we use our resources and making sure that we protect our staff as well as the visitors and patients that we have here as well. So looking at appropriate isolation equipment, make sure that we're always trained on these, not the COVID-19, but there are other diseases and viruses that are similar to this with isolation, but doing refresher courses for our staff to make sure that we're not putting our staff at risk. Looking at rooms and identifying rooms that are negative pressure, coming up with flows internally to make sure that we place the patients in appropriate rooms. So we've been conducting that exercise for the last several weeks. And I feel, when I look on the TMH side of things, we've been ahead of the curve. We have great leaders, great staff. We have a great medical staff team here. We have been a united front, and this has been at the forefront of our mind for a period of time, and it's given us time to prepare. And it's here. It's scary, but I think if we all educate together and we all unite, we can take care of our patients, and we have done so.
Okay.
On the external front, Dr. Watson, do you want to talk about the testing center?
Sure. Yeah, I'll add a little bit to what Ryan had to say about from the inpatient side as well. This is a collaborative effort amongst all staff, and one of the things that you'll hear us say over and over again is we've got to flatten the curve, and we've got to reduce the peak of incidents so that we as an organization and all organizations across the country can handle the influx of these sick patients. So I just, before walking in here, was on a call with all of the physician partners across the healthcare spectrum and going over the unified approach, the unified discussion about how do we interact, how do we treat, and how do we identify. And that's also one of the things that we did that's neat on the outpatient side. With all of the medical centers, all the medical professionals, all the medical personnel in this community came together as one collaborative effort. They're all unified in discussion. They're all unified in how they communicate with patients. They're all unified in when they receive a call, what they're going to say to those patients. And they're all doing the same thing for referral patterns. And Mark's referring to, again, to the drive-thru center. They all have instructions on how to use that. Our ultimate goal, again, is to make sure that our population is educated, our providers are educated, and they're all hearing the same thing so that you can reduce the hysteria and drive them to the right location so that and they get sick of me saying this, but it's the right patient and the right location, because we don't want them in the emergency departments. We want those 10%ers that are sick. That's who we need here. So the neat part from the business community is that a lot of these folks are businesses in this community. They have all joined in and they're all unified, and there's one front, which has been fantastic.
Very good. Thank you so much. The dynamics have changed a little bit in the last 24 hours now that we've experienced cases within our community. Can you speak to that and just obviously difficult circumstances, but as was stated, it was inevitable the case would come forward. Can you talk to that a little bit and really if anything has changed since that, or just how you all are trying to communicate that messaging both internally and externally based on those circumstances?
I'll just say something quick and I'm going to let Ryan, and this is what we set out at the press conference this morning, is that really, quite honestly, as a medical community and as a healthcare organization, you really don't change the way you screen and intervene no matter what disease process is active, whether it is COVID-19, whether it's the flu. We're always prepared to evaluate and recognize individuals that are high risk not only to affect us, but to affect others in their family, affect the community. So honestly, during these phone calls with the providers, they're already, they knew it was coming. We all knew it was coming. We all train as physicians to be ready for the worst case scenario. So that doesn't change how we approach things. And I don't think it changes how staff within the organization affect or approach it either, do they?
Agree. I'm just going to compliment what Dr. Watson said over here that, unfortunately, it has hit our community. We've been preparing, and I think that's the biggest thing is nothing changed on the preparation front, that we have been doing that. We're practicing the same. We have the training in place, so we're not responding to it. We've been proactive, and that's the good thing. I think the only change is supporting the staff. It's now real that it's here. It's educating the community that, we have been prepared. We have pushed out education. We've been preparing the staff. I think the emotional support for the staff and letting them know that we have all prepared and we have done, prepared them for this moment through the education, and they're practicing as they should, looking at evidence-based practice and just reinforcing that. So from the practice standpoint, nothing has changed. It's from the emotional side that, things have changed, and that's where we're here as leadership and, just letting them know that we're here to support them.
Now, one of the things that, some of the things that have changed though, however, is we have modified, and actually we modified them in advance of identifying the first patient. We modified those things that relate to how people engage and how people connect with each other. We limited our visitor policy to one visitor per patient. We're monitoring the patients coming in, or the visitors coming in, to make sure that they're not bringing anything with them, because again, it's to protect the patients and to protect our colleagues. We changed our approach as it relates to scheduling certain procedures, because we want to make sure that we not only protect the patients, but also recognize that there are limited resources out there, and that and as it relates to protective equipment, supplies, et cetera, we want to make sure that we preserve those for the onrush of things that might come. And quite frankly, also, we've been focused on trying to find better systems that allow us to diagnose and engage people more quickly. The lab environment, for example, there's been limited access to lab support, so it's resulted in long delays in response times. I think the patient who was here, we waited 3 days, 4 days until we actually got a result back. Even though the patient was tested upon entry into the system, it took us 4 days to actually get that. Now, we treated the patient as if that individual was a COVID infectious person during the entire time. So we didn't wait to get the response back. But the point is that the quicker we can get results back, the quicker we can engage and determine if the patient needs that continued support or whether the patient can be moved to a different environment. And now I think we've moved from several days to in certain emergent cases, we can get that down to less than to a day. And we're working on solutions that allow us to get it to within a day. But all of those things take work, because it requires not just us, but we have to get waivers at the state and federal levels. And we're engaged in all of those processes now.
And just to expand a little bit on what Mark is saying, it's really the healthcare sector catching up to, the demands. And then, I relate it to if you go to Publix or you go to anywhere and you look for, toilet paper, it's, these individuals are trying to produce and keep up with the demand. Same thing on the lab side where, this is all impacted at once, and these lab vendors that we rely on, the amount of quantity of specimens they have is a large volume. And fortunately, we're seeing them rally around and providing us solutions on this side to have this quicker turnaround time, so we can make sure that our resources are available and we're appropriately treating patients. So it's starting to get better. Those lab times are decreasing by the day.
It's been about a day that you've had the drive-through testing center up online. If you can talk about that, as you said, it's a great partnership with the city, and I know our community has been waiting for that. If you can talk a little bit about what that entails and what the protocol is before you get to that testing line.
Yeah, I'll address the protocol. So again, this was a collaborative effort led by TMH and a lot of other folks, Capital Health Plan, PPCA, there's so many to name. That's a good problem to have when you have too many people to name. That means it's a great collaborative effort in the community. the process is that individuals that think that they may have COVID-19 need to communicate with their provider. The protocol is designed so that the provider will take the assessment using the same protocol that every other office, every other medical provider in the community is using, and that is the Florida Department of Health guidelines for COVID-19. The provider will assess that patient and make a determination of whether or not they need to be tested. If they feel they need to be tested, they will submit that order to the drive-thru location, and Ryan will talk a little bit about the technicality there. One thing I do want to mention, because I know it was one of the questions that we were to answer, is that individuals that think that they are infected, think that they are concerned about COVID-19, need to communicate with their provider. Need not come to the emergency room or the urgent cares. They need to call their provider directly. They need to stay at home. They need to quarantine themselves, communicate with the provider, because the provider has all the protocols in place to handle the treatment of these patients. Ryan, you want to talk a little bit about?
Well, let me just say one thing before we go to Ryan. They hear me say this all the time. No one goes to see their hospital. They go to see their physician. The first part of a relationship in the medical environment is between a patient and his or her physician. TMH is involved in setting this system up, but it really is a platform for physicians to drive their patients to the right outcome. So as Dr. Watson says, it does start with the provider and the patient engaging. And so now Ryan can walk you through the rest.
Can't compliment the city enough. Our city officials, the city of Tallahassee, and they've been absolutely amazing. I mean, everything that we have asked for, they have met and exceeded. They've been very responsive. You know, the help from TPD, Leon County EMS, TFD, city utilities. You know, it's just been absolutely amazing. The center, Northwood, is an ideal location. You know, it's offsite. It's a big area. And the traffic flow, we had city engineers to help us design this process, and they have been stride for stride with us, and I just can't compliment them enough. When you come, just to understand the process flow. The first tent that we stop at is a tent that we're just doing an intake of information, making sure that you have that order from the physician, and then you get directed over to a registration tent, and we have a centralized fax ordering system for all our providers to fax the order to this area. And then the registration intakes that information and directs you over to the testing center and the swab center. And we have our clinicians out there that are trained to do the swabs. And the in and out process is, less than 7 to 8 minutes what we're seeing. And it's absolutely amazing to watch the collaboration. This is the first that I know of in the state. And, we received this model from Seattle, Washington, Colorado. But I think we're unique that we have not seen all the healthcare leaders as well as the city come together. When you see the models and you see the comparison, it's really done by an individual healthcare system or hospital. I think we're unique in the fact that we have rallied around as a community in the city of Tallahassee to provide the service to our community members. So it's amazing to watch, and the processes and the flows have met and exceeded our expectations thus far.
Very good. Let me ask a question not related to COVID-19 that individuals, employers, and citizens might be wondering. For other medical issues that would require a hospital, whether it's an emergency room or regular procedure, what's the thought process that needs to go through for an individual who thinks they might having chest pain, or if there's an emergency, they typically would go to the main hospital and or the Metropolitan Center emergency room?
The typical medical care that you're describing, nothing has changed. We're asking people to really be cognizant of their current health as it stands today. If they need immediate care, then we need to see you. If you need immediate care from your provider, we need to see you. I'll just remind you something that either Mark or Ryan said prior, was that we're implementing telemedicine throughout all of our practices, and Lauren Faison and the crew have done a really good job setting us up for this through these years. So we'll have the capability and ability to see patients in their homes if they need to be seen. Those that actually need to be physically seen, well, we need them here.
I was talking to Dr. Redfield the other day, and Dr. Colby Redfield is one of our medical directors for emergency services, and he was saying that he actually is concerned about people not coming to the ER when they have symptoms. He said, in fact, people who hold back, oftentimes they create a worse situation, and where they might have been able to come in and receive immediate treatment and have been discharged home, the longer they wait, they potentially create a more acute situation for themselves, and they present as train wrecks. And then therefore, then they have to be admitted. We have to occupy a bed, expend resources. So he wanted to make sure people understood, if you think you need healthcare services, come in. You probably actually, because people practice safe infection control protocols, you're probably in one of the safest places in the world, maybe safer than your local grocery store or wherever else where you're coming into contact with people under non-controlled environments. So people shouldn't be afraid to come to the hospital when they feel they need care.
Okay. Very good.
Brian, any?
I'll just reiterate what Mark and Dr. Watson said as well, that as we talk about protecting the staff, we're protecting our other patients as well. So we know that the COVID-19 is out there, but we're here to treat you for the medical emergencies that you're there, and you're in a safe environment. So if you do need that care, we're here for you.
Okay. What is the as we move through this, what would be the one message that you want to put to the community and or our businesses that they can share to the employers?
Oh, I'll let them talk. I can say it because I've heard it so much, but as a physician, I'll let the physician answer that as he should.
Right. So it goes back to right patient, right location, and following the instructions that Mark and Ryan have done a good job talking about, and that is appropriate hand washing and covering with your arm when you cough or sneeze, social distancing, and recognizing that we're not 6 feet apart, but we washed our hands thoroughly, and we're going to move apart rapidly after this conversation. But taking appropriate measures, if you don't feel well, stay at home. If everyone does this, we are going to be able to flatten that curve, and that's really what we need to do.
Great. Well, gentlemen, we want to thank you, and most importantly, we want to thank all of your employees, your line employees, your doctors, your nurses, everyone that really is contributing to this, and that's what makes our community so unique. So thank you. It's a very busy afternoon. You took time out to get on this information so we could push the information out. And if there's anything we can do to assist, please let us know. But thank you for your service, and we look forward to moving through this quickly, we hope.